My husband and I have 4 children. All were born and raised in Kansas. 2 of our children are receiving gender-affirming care. My son has always been the happiest child I've ever known. We used to call him Sunshine when he was a toddler because of his infectious joy. However, when he was in 4th grade, everything changed. He began waking up in tears, and I often had to physically carry him into school while he was fighting me to avoid going. That winter, we discovered cuts on his arms and legs. He confessed to cutting himself with scissors. All sharp objects were secured in our home, but I still found new cuts. He admitted that when he was upset or anxious, he would cut himself in the restroom at school. The school implemented a safety plan, but months later, they called us to tell us we would need to have a mental health evaluation on him before he was allowed to return to school. Our son was admitted to a psychiatric hospital for suicidal thoughts. After his mental health was stabilized, he was diagnosed with gender dysphoria, and we sought out a doctor who specializes in gender-affirming care.
The reason this bill is so important to me, that I made the trip from Colby all the way here today, is that my one and only child was transgender. I say was because he completed suicide in his dorm room because of bills like this being passed in this country. To those who say irreparable harm is done to our children and it's just mental illness, I can tell you from experience that this is never a decision that's made lightly, with a lot of research made and a lot of appointments with therapists, psychiatrists, and doctors who went over the risks and benefits and the side effects with us. Puberty blockers have been used for precocious puberty for 40 years and reversible. To those saying I was feeding into my son's delusions and he was depressed and suicidal because of treatment he received, transgender youth are not suicidal because of medical treatment, but instead because of the treatment they receive from others who make their existence a political agenda.
My child shared their non-binary identity with us at the age of 5, and they've been out at their school since kindergarten. They've experienced a lot of support from family, friends, and their therapist, and when they're in an affirming environment, they're thriving. However, they've also experienced a lot of bullying, threats of violence, misgendering, and a lot of trauma that a child their age should not have experienced, and as a result have experienced symptoms of depression, anxiety, trauma, and more. They're terrified of puberty due to that dysphoria and the misgendering and bullying they experience. And the bright light in all of this for them has been the prospect of puberty blockers. This bill would take away that hope, the thing that has been sustaining them. It would take it away. And I'm honestly afraid of what that would look like, as I know the statistics. 66% of transgender and non-binary youth have thought about suicide. 42% of transgender and non-binary adults have attempted suicide in their lifetimes, and research has shown that transgender and non-binary adults who receive puberty suppression and puberty blockers as adolescents are significantly less likely to experience suicidal ideation in their lifetimes.